A 19 health alert now, as this will be the first cold and flu season. One local hospital is equipped with a vital new tool, a tool to enhance patient care and work more efficiently. Lake West in Willoughby has implemented virtual nursing throughout the entire hospital. Jen Picciano looks at how it works and how it's helping.
Patients at Lake West Hospital in Willoughby are benefiting from University Hospital's new virtual nursing initiative.
And it helps enhance nursing, doesn't take away from nursing, it just helps enhance. So nursing isn't being replaced.
Every room is now outfitted with a camera, speakerphone, microphone, and a TV connected to a software program called Vital Chat. It allows a nurse to virtually enter the room to augment bedside care. That virtual nurse can do anything from admissions to discharges and many other use cases in between. Then they move on virtually and efficiently to another patient room, leaving bedside staff to spend more time hands-on with patients.
So one of the main complaints we always get from our patient is your nurse is always behind a screen. They're always working on a computer. You know, giving that time back to sit down and know personal things about the patient. That virtual nurse is just a second set of hands. They come in, they do the admission. That would take a nurse 30 minutes. Call the pharmacy to get their med rec.
These cameras have a powerful 20-time zoom with night vision that can view monitors, even check on patients at night when it's completely dark.
Let's say we're double checking medications such as insulin or blood. You take the camera, you zoom into the label on the patient. So at the label on the medication, you're able to see the patient's name, medical record number. You are that second nurse in that double check. Whereas they would have to find a nurse on the floor to double check that medication in the room. And if you're getting blood, the second nurse has to spend 15 minutes in that room as well.
Brian Nelson is part of the team that used philanthropic dollars to get cameras in 160 rooms, plus the emergency room and ICU, to help address a nurse shortage and nurse burnout.
It's not just support for our staff, support for our patients and providing better care or quicker care.
Nurse manager Monica Leovic says this is a game changer for her staff and their patients.
Before virtual nursing, I do not know how the nurses would even handle that caseload anymore, to be honest, especially going into flu season.
These connected care rooms aren't just for virtual nurses and other healthcare providers to use. Family members can use a link to visit with patients remotely and even listen in on a visit with a doctor if they can't be there in person. Patient Michael Toronto likes knowing a virtual nurse he's familiar with can check on him anytime he needs it.
It seems like they're able to help multiple people faster, in my opinion. It's helped me by I was able to relax without having more people in the room.
To maintain privacy, the camera is turned away and off when the virtual nurse is not engaging with the patient.
Good morning, Michael. This is Marnie, the virtual nurse from Lake West. May I come into your room?
Yes, you may. And they always ask every time, hey, can I come in the room? And I give them permission. They come in, they talk to me, and then that's it. And they're in and out.
is among the first hospital systems in the country to fully implement a whole hospital virtual nursing program. And this is just the beginning. Their goal is to put a total of 2,500 cameras in and put them to work for patients. Jen Picciano, 19 News.
Now you're